Good afternoon, guys. Today's discussion A is recognizing traumatic brain injury as a condition. Okay, so we're going to discuss that for this afternoon. Give me a minute to set up for the show, and I'll be right with you. Out the bulb a little bit. So this afternoon's A is recognizing traumatic brain injury as a condition. Okay, here we go. Here's a concise summary of the key takeaways from the article. Recognizing TBI as a chronic condition. A commentary in the Journal of Neurotrauma advocates for treating traumatic brain injury or TBI as a chronic condition, much like diabetes or depression. Current healthcare systems and insurance primarily focus on acute care, typically within the first year post-injury, neglecting long-term impacts. Long-term implications and gaps. TBI affects 2.8 million Americans annually and can cause lifelong challenges. Post-acute care options are limited, leaving survivors without necessary support for ongoing cognitive, emotional, and physical effects. Call for coordinated care models. Authors propose using tested coordinated care approaches, originally designed for populations like older adults or ICU survivors, to support TBI patients throughout their lives. Emphasis is placed on improving integration between brain injury specialists and primary care providers to enhance community of care and family support. Common causes and risk factors. Leading causes: falls, especially in older adults, sports injuries, fire alarms, motor vehicle accidents, and assaults. Recovery depends on injury characteristics, size and location, severity, age, and history prior to TBI. A breakdown of most impactful strategies: cognitive and neuro rehabilitation. Cognitive rehabilitation therapy, or CRT, targets memory, attention problem solving, and executive function. Neuropsychological support helps patients adapt to cognitive changes and develop compensatory strategies. Physical occupational therapy. Physical therapy restores mobility, balance, and strength. Occupational therapy reteaches daily living skills and may include environmental uh, modifications. A key area where your interest in memory friendly design could be transformative. Communication and language supports. Speech language therapy addresses speech comprehension and swallowing difficulties. Argumentative communication tools may be introduced for severe impairments. Mental health and behavioral innovations. Psychotherapy and counseling, crucial for managing depression, anxiety, and PTSD. Behavioral therapy supports emotional regulation and social integration, reintegration. Coordinated and community-based care. Life care planning involves certified brain injury specialists to map out long-term needs across medical, social, and vocational domains. Telehealth and community support groups extend access to care and reduce isolation. Lifestyle and adjunctive therapies, anti-inflammatory and neuroprotective diets align with your interest in nutritional strategies for brain health. Mindfulness, yoga, and music therapy offer promising adjunctions for emotional and cognitive recovery. Continuous monitoring and adaptation. Regular reassessment, ensuring care plans evolve with the patient's recovery trajectory. Caregiver education and support are essential for sustaining progress at home. Given your focus on systematic reform and interdisciplinary care, would you be interested in exploring how these treatments could be integrated into a scalable, equity focused model? Perhaps one that bridges occupational therapy with systems, neuroscience, implementing effective treatment plans for traumatic brain injury. TBI requires a coordinated evidence based and patient-centered approach. Here are the best practices drawn from updated clinical guidelines and interdisciplinary care models. Early multidisciplinary assessment, intake care with a comprehensive evaluation involving neurology, rehabilitation, psychology, and social work. Use standardized tools for assessing cognitive, physical, and emotional function. Glasgow Coma Scale, Rancho Los Amos Scale. Tried and individualized care planning. Develop tried treatment protocols based on injury severity using tools like integrational pressure monitoring. Blood-based biomarkers to guide decisions. Tailor interventions to patients' age, comorbidities, and social context, especially important for older adults or those with prior TBIs. Integrated rehabilitation pathways. Beginning early rehabilitation in acute care settings, transitioning to community-based, home-based rehab as appropriate, including physical, occupational, cognitive, and speech therapies in a coordinated plan. Emphasize community of care across settings to prevent fragmentation. Because you never want to see somebody's care plan have a hole in it, guys. You never want, if you are in senior care, let's say, and you set up somebody's care plan to go home or care plan to go to rehab facility, and it is missing a piece that they need, what you have to do is go back and reassess them for that piece that's missing, and somehow incorporate the piece that's missing for them to have a solid care plan to work off of. So that's how that works. All right. And let's see, next page. Behavioral and psychosocial support, address mental health needs through counseling, behavioral therapy, and family education, incorporate culturally responsive practices and trauma informed care, especially in underserved populations, long-term monitoring and adaptation, schedule regular assessments to adjust goals and interventions as the recovery process goes along. Okay. Be right with you. I have to straighten something up. Okay. Look better. Okay, use life care planning to anticipate future needs, including vocational support and assistive technologies. 6. System level coordination. Foster collaboration between primary care and brain injury specialists to ensure holistic management. Implement shared electronic health records and care navigators to streamline communication, education, and advocacy. Training providers. Train providers in updated TBI guidelines, including neuro monitoring, seizure pro prophylaxis, and nutritional support. Empower patients and caregivers with accessible information and decision-making tools. These practices align beautifully with your focus on systematic reform and interdisciplinary care. Would you like to explore how these could adapt into a scalable model for memory-friendly housing or frailty-informed care pathways? This is where your passion for systems, neuroscience, and regenerative care really intersect with cutting edge innovation. Here are some of the most promising and forward thinking approaches in brain injury treatment today: regenerative and cellular therapies, stem cell therapy, use pluripoints or mesenchymal stem cell to promote neurogenesis generation, and repair damaged brain tissue. Exosome-based treatment delivers cell-drive vessels that carry proteins and RNA to modulate inflammation and support healing. Gene enhanced cell therapy combines gene editing with stem cells to enhance therapeutic effects. Still experimental but promising. Regions potentially reducing inflammation and promoting recovery. Transitional magnetic stimulation, or TMS, non-invasive brain stimulation to improve cognition and motor function. Deep brain stimulation, or DBS, implanted electrodes modulate neural circuits used in severe or chronic cases. Neuroplasticity driven rehabilitation, virtual and augmented reality, VR/AR, immersive environments that enhance motor and cognitive rehab through gamified adaptive tasks. Brain machine interfaces, BMIs, enable communication between the brain and external devices to restore lost functions, especially relevant in severe motor impairments. Neurofeedback and AI guided rehab uses real-time brain activity to tailor therapies and optimize neuroplasticity. Advanced materials and bioengineering, hydrogels and nanocarriers deliver drugs or cells directly to injury sites while preserving blood-brain barrier integrity. Carbogenetic nanozymes, antioxidant neuromaterials that reduce oxidative stress and inflammation in the brain tissue. Backpack macrophage therapy, engineered immune cells that target chronic inflammation and promote tissue repair. Okay. engin- engineered immune cells that target chronic inflammation and promote tissue repair. Holistic and adjunctive innovations. Photobiomodulation or B or PBM, low level light therapy to stimulate cellular repair and reduce neuroinflammation, precision nutrition and microbiome modulation, tailored diets, and gut brain axis innovations to support cognitive recovery. These approaches are still evolving, but they reflect a shift toward personalized systems-based care, something you're clearly passionate about. Would you like to explore how these could be integrated into a memory-friendly housing model or adapted for frailty-informed care pathways? That's a rich question, and one that really highlights the shift from compens- comp- compensatory care to restorative and system-based healing in brain injury treatments. Let's break it down. Traditional treatments stabilize and compensates. These have long focused on symptom management using medications, physical therapy, and occupational therapy to help patients adapt to defects. Rehabilitation, emphasizing repetition and routine to regain lost function. Supportive care, including counseling, caregiving, education, and environmental modifications. While effective in improving quality of life, traditional methods often don't address the underlying neural damage or promote regeneration. They're essential, but they tend to plateau in effectiveness over time. Innovative approaches and rewire. These newer strategies aim to stimulate neurodegeneration and plasticity, including stem cell and exosome therapies, targeting cellular repair and inflammation reduction. Neuromodulation, TMS, DBS, rewiring neural circuits to restore function. Virtual reality and brain machine interfaces, enhancing engagement and neuroplasticity through immersive adaptive rehab, photo by biomodulation, and nanozymes, reducing oxidative stress and promoting cellular healing, precision nutrition, and microbiome modulation, supporting brain recovery through systematic health. These approaches are more personalized, tech integrated, and biologically targeted, offering hope for recovery even years post injury. Key differences briefly. Now I'm going to go through the key differences. Featured traditional treatments. Goal: compensate for defects. Mechanism: behavior and physical adaptation. Tools: PT, OT, speech therapy, meds. Recovery: often front loaded. Innovative approaches: repair and regenerates, cellular, neural, systematic modulation. Stem cells, BR, TMS, AI guided rehab, extended even chronic phase potential. Okay, system integration, fragmented care pathways, moving toward coordinated tech enabled models. Okay, now that is A for you. I'll be back on shortly with B. Give me a little bit to put that together, please. And I'll be back on with it for you. For now, Gator Wellness, take care, folks.